Now that's a really, really good question and a great example of that. And again, it illustrates whether you're young or whether you're male or some other toughness factor in those areas. What he manifest was an acute manifestation of a chronic stress problem, right? Okay, and it just came out in anxiety, and he said, "Sharing it, and I'm fine." And so, first of all, I congratulate him on how well he's doing in managing the stress. Okay, he clearly is. If he and his wife have lost the job, they're social isolating, the pandemic's going on, other things are happening. They clearly are having a lot of changes, like so many people are. So he has the ability to manage the stress most of the time. That's fabulous. Okay, that's great. He has coping techniques to do that. That doesn't necessarily mean that the stress isn't having an effect, even though he can cognitively manage it. Okay, now the anxiety burst was a time when it broke through, right? He had to go to the ER, but that low-level stress is going on all the time. And he seems to be really good at it, but you know what? Those things take a toll on his body. And as we talked about in the mind-body section of this earlier, that kind of autonomic set point, the sympathetic nervous system set point, then can imbalance the parasympathetic, the rest, the relaxation, the healing components of the body. Cortisol levels go up, inflammation aspects go up, and so your body is still getting impacted by the stress, even if you're really good at managing it cognitively. Okay, and so understanding the science of it and talking about the value of doing mental exercises to boost the relaxation response and improve those areas helps to reframe this. For many folks like this who think that I've got it under control, when in fact it's still going on underneath the component, underneath the body. The body actually is responding to it. Another way you can explore this is that he's dealing with the anxiety, great, but how's his sleep? Okay, we'll talk about sleep. And very often there's disruptions in sleep, for example, or there's disruptions in digestion, which is another autonomic parasympathetic nervous function in those areas. And that's an example of how the body is trying to make management. So engaging in the stress management techniques, the relaxation response, even if you're really good at managing the stress, okay, can still be beneficial for your health. And so this is the kind of approach that I would take with somebody that you just described.